Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, I have on my show Xiao-Mei Zeng, who is a practicing OBGYN specialist in Boynton Beach, Florida. Her goal is to provide current and compassionate women's health care in a fashion that acknowledges her patients' diverse values, backgrounds, and conditions. I want to welcome to my show Dr. Xiao-Mei Zeng.
Good morning. How are you, Susan?
Thank you so much for asking. I'm actually very fine. You know, I want to just get into your whole practice. I want to understand what is so important about an OBGYN and the functions and the things that you do as a specialist in this very, very exciting field. Now, first of all, let's give the audience a definition. What is an OBGYN? Because not everybody knows.
Correct. Actually, it's funny you asked that. I was at the Kentucky Derby show, and a friend of mine said that, so what do? You deliver babies, right? I said, not only that, I take care of patients from very young age, probably around puberty time, until they're 90 years old. And I do a lot of well care and making sure patients taking care of themselves. I do birth control, sexually transmitted diseases checking, and I consult patients before they go to college. I give them the scoop about the college, meaning that they have to take care of themselves as young women. They have to stay in school because they pay a lot of money towards it, and stay out of trouble, meaning no drugs, no alcohol, no smoking, and then safe sex. And then after that, I take care of patients who are in their reproductive ages, and whether they have relationship issues, whether they have the birth control issues, whether they have dysmenorrhea, endometriosis, fibroid issues, problem with bleeding, and then perimenopausal age is really, really a big problem for a lot of women. And they come to me when they have their perimenopausal symptoms such as hot flashes, insomnia, mood swings, and problem remembering things, gaining weight up to 30 pounds during this period. And also I gave people advice about how to exercise, how to take care of their body, and diet, and other alternative medicines such as yoga, tai chi, acupuncture, massage, chiropractor. Up to there, I tell my patients when they are, I've never seen a yoga practitioner not being able to get out of bed because their body is so flexible, so limb, they have such a good core. So that's my scope of my practice, is provide comprehensive and holistic care to our patients.
So you're involved in the body, mind, and spirit. That's a very holistic way to treat patients. Here's what I want to know. We just passed a health plan. I think it just went through Congress. Now, I know this is like an apples and oranges question, but I want to understand how you feel about the health plan, and if you don't like it, what you would do to change it.
Well, I think this is a very complex question, and I believe that as individuals, we have our responsibility to take care of our body. However, if there are people who have predisposing conditions that they cannot afford the insurance, or the insurance will not take care of them, I think these people should be taken care of in some ways. I just think it's in America, it's such a complex situation where the people say, why is it so expensive in America to take care of your body? I think there's a lot of things. insurance, it could be an issue. Drug company could be an issue. And people don't think about our government, our system actually is very, very much involved with the medical legal issue. And a lot of doctors, they're doing things to protect themselves rather than do the best for the patient. I remember specifically I had diagnosed a patient postpartum appendicitis. I pressed there. She had appendicitis, but then I have to do the evidence-based medicine, which is order a CAT scan and convince everybody this is appendicitis. But in other countries, and this is actually indicated, but a lot of times there are things that's not so indicated. Say if I have a patient with a prolactin just slightly elevated, and then I have to order an MRI, which costs a lot of money. And sometimes you do a CAT scan, MRI, rather than the ultrasound, which costs a lot less.
Yeah.
What I'm saying is that we do a lot more for our patients, waste a lot of money because the fact that we could get sued. And lawsuits are very expensive, and a lot of doctors cannot afford their malpractice insurance. So that's why I think a majority of the problem is that we're doing a lot of defensive medicine instead of what's best for the patient.
That's pretty horrible, I think, and I'm sure that the government needs to know how doctors feel, because I know that you're a perfect example of a doctor who cares about the whole body, and you treat your patients in a way that you make them part of your family. So let's just make sure that doctors like you really speak out. Now, let's talk about another thing. Let's talk about the obstetrics. You help people take the right steps to having a healthy pregnancy from start to finish. Give me some of the things that they have to do.
First of all, if you are trying to get pregnant, making sure you have taken your prenatal vitamins. That's essential because a lot of times we see patients with neural tube defect that is so easy to prevent because we're not taking our prenatal vitamins. And then as a patient, what I would do is take the family history. What's my family history? Do I have high blood pressure, diabetes, heart disease, any congenital problems that you inherited from your parents? One patient I remember, she said, do you have a Huntington's disease in the family? She said, how do you know? Because they do. They don't think about this. And it is inherited. And it could be a problem with this her baby in 50% of the case. And then there's other things that you could help yourself with is making sure you have a good diet and do exercises and keep the weight low. Hypertension and diabetes is epidemic in America. Obesity is epidemic in America. And people don't think about this. If you go to the malls, you go to all-you-can-eat restaurants, and you see people are very obese. And I have colleagues, they're coming from Alabama or Texas or Ohio. A lot of people end up with C-sections because they're obese. They get complications such as diabetes and hypertension and seizures. Those are really tremendous, had tremendous impact on this woman and her health after the baby. So if you're trying to get pregnant, you really have to think about what can I do for my baby, right. Meaning take your prenatal vitamins, exercise, keep your weight down, and do the best for your baby from the get-go.
Now, let's talk also about family planning. Explain to our audience what family planning means and what are the best ways to treat one's body and one's mind.
Okay. Family planning is very important because I think a lot of I started, some of my patients are very young, and by the time they come to me and and they could get pregnant when they're like a teenager. And the saddest thing that I remember, I was trained in Jackson Memorial, a 13-year-old with twins, and this is her second pregnancy, parading around the hospital like she's a winner. What kind of care would she give to her kids? What kind of example she would set up for her kids? So it's really important that in the school we teach the kids on birth control, and we want desirable pregnancies. I mean, talking about abortions or things like that, it's not the way we plan a family. We have to really, it's not just the school. It has to come from the family. The parents have to talk to the kids about how to protect yourself from unwanted pregnancy. Of course, there's birth controls and there's IUDs, and but if you are have a good family relationship and try to making sure this young lady, she will take care of herself and not get into a situation she doesn't want.
Yeah.
And the saddest part is that I have patients, they got pregnant and they kept the pregnancy, but they get set back on their college goals by 10 years. And the parents are no longer together by the time they are, by the time they already grow up with the children.
Well, what do you attribute to the fact that there are such young girls having pregnancies? Do you think that it has something to do with the economy, or it has something to do with the fact that they're not educated?
I think there's multiple issues. I was a teacher before I was a doctor. I was 2 years teaching in Hollywood, a Christian school. And I think it's that, it has come from family, have to make the young ladies feel that they are important. They got to take care of their body and respect what they want, but not the family has to talk to each other. And I was always talking to my colleagues. Even I'm very busy, but we sit down at dinner table as a family and sit down and talk about things. Doesn't have to be, the parents doesn't have to, drive down the throat and make the kids think about what they think about. Just talk about general things, and then you pass your value to your kids in a gentle way, and also they're getting your ethics through osmosis, you just breathe through and get your family value. I think it's so important. As a family, we need to get together. Your parents, grandparents, you have values and you have your ethics. You have, and then pass on to your kids. And then it's really important when the kids have a problem, instead of running to the boyfriend or whoever can give them some support, you should come to the family.
Yeah.
And also, it's really important to protect yourself using condom, using birth control. And nowadays, there's Plan B and over the counter. But it's really important that we don't get ourselves into a situation of unwanted pregnancy.
Now let's move on to hormonal evaluations. You talked about the fact that sometimes people have a predisposition to all different kinds of problems, like you mentioned Huntington's disease. Now, having a hormonal evaluation, does that help to understand what is going on in one's body?
Well, as far as the hormonal evaluation, everybody is different, and everybody reacts to perimenopause differently. And what I see is that majority of people would do okay by doing exercises, taking fish oil, taking supplements. We have the supplements over the counter, such as Astrovan, Danquai, Primrose Oil, and then there's a new supplement called Relazin. It's from Sweden, and if they can And also fish oil is really important, omega-3. They do it, their exercise and taking these supplements, if they can take care of that, and then you can resort to hormonal replacement, or some people will go to bioidentical. But very, very important is that hormones can cause breast cancer. So before you go on hormones, it's really important to have mammogram and sometimes even an ultrasound, making sure your body is not prone to such diseases as breast cancer and uterine cancer.
Yeah. What about pap smears? Is it very important that people do pap smears, or women do pap smears every year? How does that work? I
think it's really important for women to visit their doctor. And if it's not every year, at least every other year. I understand the task force says that, you shouldn't have your pap smear anymore after hysterectomy, or no more pap smear after 70, or young women should have pap smear every 3 years once they have their pap with HPV. But we've seen people will have changes. They may have HPV that's silent, and 3 years later they come back and they have cervical cancer. I've diagnosed patients with cervical cancer and uterine cancer in postmenopausal women. And I think it's still important. Who is going to do your breast exam? Who's going to do your rectal exam? And a lot of people, I found that they, instead of say if they lost their spouse or they have problem with a family members, they come to OBGYN. They sit down and talk to their OBGYN, talk to me, and share with me the information so I can refer them to proper physicians or therapists. I mean, a lot of people, they have urinary stress incontinence. They don't want to share this with their doctor who's male, can't understand that, or they may or they may not. But then always what happens to me is it's like I would do my exam and everything, and then before I leave, they say, excuse me, doctor, I have this problem, because they feel ashamed about discussing urinary stress incontinence, or dyspareunia, which is painful having sex, which is really what they want to discuss. But they waited to the last minute, and then they bring it out. And then, and I think women, OBGYN has a special place in women's health care, that we are not only just do pap smears and deliver babies. We're here to share information and help these women who otherwise would not go to a doctor or would not share the information about their family, their stress in life, and mental issues. Or sometimes, I have patients that during the pregnancy, things happen. There's violence, and they don't share with me throughout the pregnancy, and afterwards they will share. So these are the things that that's why it's so important for women to go to their OBGYNs. So not only the OBGYN is your go-to person for delivering babies and doing pap smears, also they'll be there to help you with other issues. And a lot of people are willing to sit down and listen to you, provide a primary care role for these women.
Now, what about depression? It is, everybody understands that sometimes after birth, women suffer from postpartum depression. How do you treat that? I mean, you're an OBGYN and not a psychiatrist, but can you deal with that? And how do you do it if you can?
Yes, we do see depression in multiple occasions. We see depression when the kids go away from home to college, and sometimes they can't cope with staying away, in a strange place, staying in the college dorms, having problems, and they come back and they come to me and discuss about the depression, and then we try to refer to proper providers. And postpartum depression is a big thing. A lot of times before I send patients home, when they're in the hospital, I always remind them it's really important to get enough rest. You have to get a family member to take shifts to help help you take care of your baby. In Chinese culture, is that this month after delivery is very important. Usually they have the family, the mother, the aunts, grandmother, everybody takes shifts to take care of this woman. And the postpartum woman, usually they don't cook, they don't clean, they don't do dishes, they don't shower, and the whole bit. But what I tell my patient is that it's important everybody takes shifts to take care of you. And in addition to that, you should try to have a schedule, meaning you get up, you feed the baby, you eat breakfast, you take a walk outside. I mean, southern Florida is beautiful outside, and make plans with your girlfriend, with your family. Go out to lunch in the afternoon, take a long nap, and do some exercise. Walk the baby out. And sometimes baby needs some sunlight too, and try to take good care of this pregnant postpartum woman, right, because this is a time when hormones go up and down. You may have depression. Other things, it's really important for them to take high dose fish oil, do exercise. Walking is really important, not strenuous exercise, but walking, and have good schedule and have good family care. Yeah. If you see a woman who has 3 kids already, and she's having this 4th child and no help, this is a time that they need help. If you have to have family coming, or maybe even hire a nanny to help this pregnant postpartum woman, yeah, and it is a good investment.
Now, last but not least, Doctor, if you had a chance to say something that you think is one of the most important things to tell our audience, what would that be?
A test of Pap smear. I think Pap smear has changed the field of cervical cancer tremendously. I think that Pap smear needs to be done, and with HPV testing, I think that's very important. Secondly, mammogram. A mammogram detects breast cancer 2 years before any OBGYN can find that lump. And breast self-exam is very important, even though the study in Canada said that it's not important, but I believe breast self-exam is very important. Most of the time, patients find their lumps, they come to us. And because OBGYN only see the patient once a year. And you're with your body, you're in tune with your body. So a premenopausal woman should do a breast exam 7 days after their period, and I suggest postmenopausal women who don't have periods, they should do their breast exam on their birth date. Say my birthday is June 28th, so right, every 28th of the month I'm doing my breast exam.
And so, Dr. Zeng, did you ever write a book? And if you haven't, are you considering it? Because you have so much information, and I know there's a lot of information out there, but today is a different day. It's a different time. It's a different part of life for many, many people. So any plans to write a book, to do something that explains to women and men and families what are the most important things? Are you doing that?
I haven't started yet, but I've been thinking about that. In addition to what we've said, we've talked about women. Women is a pillar of the family, and there's nothing more important than family. Family makes the cities, the states, the country. So the family is so important. So it's important we take care of the women, the young girls, and the older women, And that's so important.
Well, my guest today has been Xiao-Mei Zeng, who is a physician practicing OBGYN in Boynton Beach, Florida. And as you can hear, she's given us a lot of information. And if you need to, if you want to get in touch with her, how do they do that, Dr. Zeng?
I practiced OBGYN in South Florida for the last 20 years. And I have an office in Boca as well as Boynton Beach. My office number is 561-734-4545. And then you can also look me up on Google me on the internet, and my address, phone number, and I think we have a yellow book page and showing you about my office and my staff. And we have a fantastic team in my office. We're here to serve all the women in Florida, in South Florida.
Well, thank you very much, Dr. Zeng, for being on the Susan Brender Show. You're an inspiration, by the way, because you talk about so much that deals with the body, and you're not just tied into this conventional medicine. You think about the whole body and the mind and the spirit, and that's a phenomenal way to think about things. So, again, I want to thank you very much for being on my show.
You're very welcome. Thank you very much, Susan, for inviting me to the show. I really enjoyed it.
Thank you.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.